Hello, everyone. My name is Louie, and I'm a board-certified psychiatrist, and I'll be talking about cybersecurity, the signs and symptoms of a mental health attack surface. I want to give my thanks to the Layer 8 conference for this opportunity to talk with everyone today. As a psychiatrist, I always ask my favorite question, how are you feeling? And right now, for many of you, you're looking at the Layer 8 conference talks and experiencing the sessions, and there might be a lot of things going through your mind right now. And the range of thoughts and emotions and things that you're experiencing can be of a wide range. And we take a look at this through a mental health inventory. There could be a lot of things going on, and it might even look something like this. There's a lot of words here on the screen describing many different types of emotions, thoughts, and feelings. And everyone, to some degree, experiences these at different points in different moments and in different kind of contexts. But it shows that there's a broad group of things in the mind, and it's amazing that all of these can fit within the space of a brain. As I was thinking about this idea of the attack surface, I was looking at the physical dimensions of the brain itself, the surface area of the brain. And the surface area of this brain, of the cerebral cortex, is actually about 2.5 square feet. It's about 4 open pages of a newspaper, as shown here. But what we do know is that the words printed on paper and the thoughts and emotions and the feelings in the mind definitely go beyond just the surface level and could be something deeper. And whether or not a person with bad intentions has access or manipulates that content is of importance here in our discussion. During the COVID-19 pandemic, there have been tremendous impacts in all areas of daily life, affecting everyone. There are effects on people's health and their professions, their work, working from home. The boundaries between what is work and what is personal life have been blurred many times. There's a lot of different things in the news and information, including good information and misinformation. There's a big effect on the economy and our finances, both at the global level and also at the personal level for people. And of course, there's the feeling of security and well-being. The COVID-19 pandemic has certainly challenged these aspects of daily life and continue to do so. And there are many issues as well. Cyberattackers and people with bad intentions have certainly looked into each of these areas and tried to take advantage of each of these elements and more for their own purposes. The FBI Internet Crime Complaint Center, or the IC3, comes out with a report every year. And here is the data from the Internet Crime Report from 2020. And it shows in this chart that there are many different types of cybercrime, and it lists the number of victims for each. For every type of cybercrime, there is a mental health impact component to it. For example, for victims of identity theft or data breach, people sometimes tell me that they feel violent, or they might experience paranoia or feel anxious. They might even start to develop habits where they avoid the use of technology or distrust it. So there are definitely impacts in terms of a mental health effect from cybercrime and of cyber attacks. We know that there are very common things experienced by people in the medical profession, as well as security professions, such as cybersecurity. Both professions have a high degree of work stress in their environments, and it is a constantly changing type of landscape. Oftentimes, the information cannot be shared, which also means that the people who are working in these fields cannot freely express or seek help in the traditional ways that other people would, just because of the nature of the things that they work with. Oftentimes, people in these professions are asked to make very difficult decisions when there's not enough information or not everything is known. They always have to keep up with constantly evolving types of situations and situations with knowledge. And it's always a different field and a different type of scenario that can be shifting. People are always on alert, and they always have to look out for the new left field type of item that has never been seen before. And there are oftentimes pressures from limited time, limited resources, and of course, the nature and culture of team dynamics and how people function at work. So several different stress areas for both of these fields. Now we know that in cybersecurity, there are mental health issues of several types, including things like stress, burnout, it could be anxiety or depression. There can be even other kind of issues as well, including substance use issues, personality issues, delusions or paranoia, or PTSD type of symptoms. So a wide range of mental health issues. And these impacts can be on both first responders and victims. And these might be the same person. So the security of people and the security of technology actually becomes one and the same as technology becomes so intertwined with our daily lives. So psychiatry plus the combination of cybersecurity makes cybersecurity. And there's the mental health attack surface that we are talking about here. But this mental health attack surface, how do you know if something might be happening? That there might be an issue going on. There's a couple of things that we could look at, and I'll go through each of these items here to describe what they might be. And these can be very useful to identify if a mental health attack surface is there and to understand some ways in which how we might be able to manage it. The first one is about the Hippocratic Oath. Physicians take the Hippocratic Oath to provide ethical care, to do, first of all, no harm. People with bad intentions have what I call the Anti-Hippocratic Oath. They first do other things, and those other things are likely to be opposite to what the Hippocratic Oath embodies. So for this, we encourage people to always ask questions such as those questions asked by a journalist. The who's, the what's, the when's, the where's, the how's, and most importantly, the why. Why is somebody asking this type of information of us? And who are they? What do they want? In what context does this happen? And in which kind of ways? Understanding all of these elements is really important to know how a person is interacting with you, or as I tell all my patients, that any type of medication or treatment or thing that you consume, such as news or things you read, becomes a part of yourself. And you want to be able to feel comfortable with what is entering your system. So similar to this graph diagram here, you always want to look at who it is that you are working with and what items you are using. I think it's also helpful to always think about how physicians think. And here's an example of a physician's path of thinking and a common medical note structure. Oftentimes, physicians meet a patient and start with a chief complaint. It's what the patient comes to see the physician for in terms of a problem. The physician would conduct an interview and gather information and learn about that patient's history of present illness or how that condition came to be. For psychiatrists, they would look at the past psychiatric history, things that happened in the past. We would also look at medical issues that occurred in the past medical history. We would look at things like the social history in terms of work and family and any substance use kind of issues and hobbies, things that people enjoy, all that information. We will look at family history in terms of other people in the family with mental health issues or other medical issues. Then we would do the mental status exam, which looks at things like any mood symptoms, any cognitive issues, any auditory or visual hallucinations, and other things. We'll look through the review of systems, looking at each system step by step to look to see if there are any issues there. And then we would have other information from clinical information or labs that could help in our treatment. And then we put all this information together and come up with an assessment, and then finally come up with what we think could be occurring, building our list of diagnoses. And then for this list of diagnoses, we create a list of what we think could be the most likely diagnosis, and then going down the list to less likely. And finally, we come up with the patient with a treatment plan. So this way of thinking goes from the top to the bottom, starting from the patient's problem all the way down to a plan. Now, people who have bad intentions, such as cyber attackers, might use the reverse, the opposite of the sequence of thinking. They would identify a target and have in mind what they wanted to create. And essentially, they are working towards creating a new problem. And this might involve them looking at different aspects of a patient's history and of condition and of a current situation, and build backwards through various different means to create a new type of issue, or to make it worse, or to somehow manipulate a person's mental health for their objectives. Another element is the idea of precision medicine. In this kind of case here, we could think of it as care that's being designed specific for a particular patient. The patient is here to receive some care, let's say at a clinic or at a hospital or from a provider. And it might follow this type of trajectory where the patient, as we described before, comes up with a problem, and there's an interview, a diagnosis is made, followed by an assessment with a treatment, and we monitor for the patient's response. And each treatment plan would be tailored specifically for the needs of that patient. People with bad intentions might maluse and misuse this use of precision medicine and create something called psychiatric engineering. For example, if signs and symptoms are exploited in terms of a mental health exploit, that might lead to an altered interview with the physician, leading to an engineered diagnosis. The assessment would be altered, followed by an altered treatment, and then the response of the patient would be compromised. You might imagine that a scenario such as this might not be even to the awareness of the patient or the physician, and it may not be entirely clear in terms of what might be happening, or if there is something of a type of mental health backdoor, so to say, that's underlying the whole process, and it's not being aware of it. That's not to the attention or the awareness of the patient or the physician. So that brings us to this idea of the things of horses, zebras, or things that are beyond that. In medical school, they always teach us about knowing the things that are common. So like the horses, you have to know those, they're bread and butter. But then they also teach us that we always have to look out for the zebras, things that are rare but important because of their significance and of their severity and condition. And oftentimes they're tested on medical board exams, so we have to know those. But then to the far right here are things unknown to the mind. They are things that have not even been considered. They weren't in a person's set of knowledge or experience. And so it is something that appears out of the blue, so to say. And I think in cybersecurity, that would be called something like a 0 day. But there's always that type of possibility even in medicine. So building that differential diagnosis is something that not just physicians do, but I think everyone can do. We always have to look at what is common, what is rare, and what could be that possibility, to always have that open mind when assessing a situation or a type of condition. A good example of where we can start and to examine different examples of interaction, or let's say a patient's condition or setting, is Charlie Brown. So with the holidays coming around the corner, there's the classic holiday television special called A Charlie Brown Christmas. And in this case, Charlie Brown, the character here, feels depressed despite the holiday season. And Charlie Brown seeks the help of Lucy, the psychiatrist, which is shown in this screen capture here. Now, there's several things just in this snapshot that we could look at to think about this idea of like who's helping us and what type of care is being sought after, and whether or not the results are effective or not, or safe. I've circled a couple of things here in this image, and that shows some interesting things. The first one at the top is 5 cents. It's the idea of finance and of cost. There is certainly a financial component to healthcare and of receiving care, and the interactions and meanings and emotions of that are very complex oftentimes, and that they can definitely have an impact on a person's mental health. That canister of coins for Lucy, she actually asks Charlie Brown to deposit 5 cents before the session started. So that idea of a conflict of interest, or that motive, or that element of finances that could alter a relationship between a physician and a patient here, and extended to a broader sphere, the interactions between a person and the other people that they work with. We see Lucy's expression here of being very satisfied with the coin that Charlie Brown has just deposited, and she feels very satisfied with it. And so the motives of people, of who they are and what they're trying to do, and where their mindset is it aligned with what we want in terms of the service, or is it somewhere else? Finally, at the booth, it says the doctor is real in. So the doctor, like, who is the doctor? And or extended to a broader sense, who are these people? What are their roles? And what are they portraying? And who are they really serving as in terms of people? And there, it looks like Lucy, the psychiatrist, is really in. But that brings up a great question in terms of really in. What does that mean? Are they physically here in terms of presence, in terms of their mindset and their motives and their ability and desire to help and serve a person? Is that really it? We have in the lower left-hand corner a circle around snow. This is a setting of a psychiatric booth in the middle of a snowy kind of place outside. So it just brings up the idea of setting. It's the idea of where the interaction is occurring and in what type of place and what kind of conditions. And finally, perhaps even most importantly, we look at the expression, feelings, and thoughts of Charlie Brown, the patient here. In this picture, Charlie Brown seems kind of depressed, and maybe he's kind of anxious. And we've known from Charlie Brown's story that there could be some depression, there could be some anxiety. But could this be something more, like a major depression, like a major depressive disorder, or a generalized anxiety disorder? Certainly, Lucy, the psychiatrist here, ultimately, I think, helps out Charlie Brown, because she invites Charlie Brown to participate and to take a lead in the community Christmas play, which ultimately lets him discover his meaning in purpose, and he actually feels much, much better at the end of the story. But in other cases, there may not be people like Lucy, the psychiatrist, or other people. There can be people who tilt the scales towards more of a major depressive disorder as opposed to, let's say, just a depression. We know that Charlie Brown has this reoccurring depression every year around the first couple weeks of December when the show airs. And then we know that at the end of the episode, at the end of the show, Charlie Brown feels better. And then we see him again the following year. But there can be situations where the symptoms might be manipulated in terms of their effects, the conditions of and the settings might be altered so as to serve a purpose for someone who has different intentions. And we always have to look out for that. Similar for the anxiety aspect of things. Charlie Brown always seems to be worried about something. And although he may not have to the degree of, let's say, a general anxiety disorder, or it's actually, we don't know because Lucy's psychiatrist has not really asked all the questions that we typically would, but it's the idea that with a certain set of conditions, can conditions be made worse with other manipulations and other techniques? And we should always look out for those. So here's a summary of a set of things where we should recognize the features of a mental health exploit or an MHE. These are certain things that we could all do to always be cognizant, to always be aware of what's happening around us. We start out by that question of my favorite question, and maybe everyone's favorite question. How are you feeling? We have to ask, who is asking this question? Why do they want to know? And who else is looking at this from this type of perspective besides just us? It's always important to learn about what kind of emotions and thoughts and feelings are in your current mindset at this current time and of other times as well. You want to know the whole landscape of everything that is available, because by being aware of things that are there, we're more able to address it if they occur and if these types of emotions or feelings or thoughts come to the surface. We talked about the Hippocratic Oath and the Anti-Hippocratic Oath that is done by people who have bad intentions in that anti-Hippocratic approach. So we ask these questions of the whys, the hows, the whens, the who, the wheres, the whats. So always understanding at a very dynamic type of pace, always checking in, what are the answers to those questions? We talked about the opposite reverse sequence of thinking and of doing of people who have bad intentions of going through the process of how a medical condition or a psychiatric issue is addressed. And it's going opposite with the order of what a physician might do. And how that might be useful is that in thinking about how physicians think in terms of the process of care, we might be able to be cognizant when something does not seem to fit that pattern. If something else occurs in which it makes you kind of think, hey, that's an unusual sort of sequence, or why would they, go in this type of way? Anything that might trigger a type of curiosity or something that's unusual or something that doesn't feel right. Understanding the sequence and the pathway is important so that we can detect things that may not necessarily follow that pattern. And finally, there's the use of maluse of precision medicines, things that are precisely tailored for a patient's care, and to twist it and to make it used in different ways and manipulate it so that psychiatric engineering occurs. So whereas physicians tailor a patient's care specifically for that patient, a person with bad intentions might use that precision knowledge to manipulate a person's mental health in a way that serves their purposes. We always look for things that are common, the horses, look at things that are rare but important to know and with more severe consequences and effects in terms of zebras. And also we should always keep in mind for things that are not immediately known to ourselves. to always explore, to always have that communication with other people so that you keep your knowledge and antennas updated and actively receiving information. I always like to let everyone know that deep down, everyone has in their DNA as a human being the aspects of wanting to be well for their mental health. You don't need to be a psychiatrist to do this. We don't need to be a mental health professional. Everyone has a voice and an expression and a viewpoint about mental health, and everyone can do something to help out. Here are some general things that people can do to design their own pathway forward. It's important to dedicate time for themselves, things for fun, spending time with family or friends, or doing things that are not related to work, having hobbies, and taking a moment for self-reflection and do it regularly. Set aside that time on the calendar for a person, for themselves. It might be taking a walk or doing some journaling, doing mindfulness activities or other things. There's a wide range of things that people can do. We should always keep in communications with people that you trust and to look out for each other. And this can include friends or families or people involved in their care. It doesn't have to be a lot of people, but it can be a core set of people that you can go to when you need some help. And always keep learning about mental health and to get the care and the help if you need to. Stay in touch with your physician and let them know how you're doing and reach out to them for any care that's needed. And as an organization and as a person at the individual level, everyone has the ability to create cultural change through mental health leadership in their own ways, and then to make mental health a key component of their daily routine and of their organization's mission. And always, it's important to stay connected with the community, especially from different fields and different backgrounds. I've certainly learned a lot from people outside my own field of psychiatry. And I think it's working together, building that big sphere of knowledge with everyone else contributing and to exchange ideas. That's the way how we can build resiliency and to be stronger together as a community. So I always like to tell people to always start with security in mind, and that it's something that you can always do wherever you are. Thank you very much, everyone, and please enjoy the rest of the Layer 8 conference and continue to stay connected. You can find me on Twitter at Ryan Lee, and thank you very much. Please take care and keep up. Bye-bye.